Hello, I'm Dr. Richard, and if you're over 50, I want to ask you a simple question. Have you ever had a strange headache that felt different from your usual headaches? Or maybe you suddenly felt dizzy, couldn't find the right words, or noticed one arm just didn't feel quite right. But a few minutes later, everything seemed normal, so you ignored it? If you have, you're not alone. Every day, countless people dismiss these small changes as stress, aging, poor sleep, or simply having a bad day. They tell themselves, I'll be fine tomorrow. Sometimes they are, but sometimes, those tiny changes are the brain's final warning before a stroke. One of the biggest myths I hear is that strokes always happen without warning. In reality, many people experience subtle symptoms before the emergency begins. The challenge is that these signals can be so mild that they're easy to overlook, or so brief that they disappear before anyone thinks to call for help. That's exactly why this conversation matters. A stroke is a medical emergency, and every minute counts. The sooner someone receives treatment, the greater the chance of protecting the brain and reducing long-term disability. Knowing what to watch for could help you recognize when it's time to seek emergency care without delay. In today's video, I'll walk you through 7 small changes that may appear before a stroke. Some last only a few seconds, others may come and go. And while these signs don't always mean a stroke is about to happen, they should never be ignored, especially if they appear suddenly or are completely out of character for you. You may even remember experiencing one of these yourself. Perhaps your spouse has mentioned one. Or maybe you'll recognize something that happened to a parent or close friend years ago. My goal today isn't to scare you. It's to give you the knowledge that could help you respond quickly if you or someone you love ever experiences these warning signs. Because sometimes the difference between a full recovery and a lifetime of disability isn't luck. It's recognizing the warning signs early enough to act. So, let's take a close look at the first small change, one that many people brush off as simple fatigue, even though it can be one of the brain's earliest signals that something isn't right. Imagine you're sitting at your kitchen table, enjoying your morning coffee. Everything seems perfectly normal. Then, without warning, you notice your coffee cup feels strangely heavy in one hand. Maybe your fingers don't seem to grip quite the same way they usually do. A few minutes later, everything feels normal again. Most people would shrug it off. I must have slept on my arm. I probably pinched a nerve. I'm just getting older. But when weakness or numbness appears suddenly, even if it disappears quickly, it deserves your attention. One of the earliest warning signs of a stroke can be a brief interruption in blood flow to part of the brain. Doctors sometimes call this a transient ischemic attack, or TIA, often referred to as a mini stroke. While the symptoms may disappear within minutes or hours, a TIA is still a medical emergency because it can be a warning that a more serious stroke could follow. The tricky part is that because the symptoms go away, many people convince themselves nothing serious happened. In fact, studies have shown that some people experience warning symptoms hours or even days before a major stroke, yet never seek medical care because they feel back to normal. That's a mistake no one wants to make. The first small change to watch for is sudden weakness or numbness on one side of the body. It might be your arm, your hand, your leg, or even one side of your face. Maybe you're carrying groceries and one shopping bag suddenly feels unusually difficult to hold. Perhaps you're gardening and notice your hand keeps dropping your tools. Or you're walking through the grocery store and one leg feels oddly heavy for a few moments. The important word here is sudden. Arthritis, old injuries, and muscle soreness usually develop gradually or have an obvious explanation. A stroke warning often appears unexpectedly without any clear reason. Another clue is that the symptoms usually affect only one side of the body. If you suddenly notice one arm feels weak while the other feels perfectly normal, or one side of your face feels numb, that's not something to ignore. Family members are sometimes the first to notice these changes. A spouse may ask, "Why are you holding your arm like that?" A friend might notice you aren't using one hand naturally. Sometimes the person experiencing the symptoms doesn't even realize anything is wrong. That's why paying attention to sudden changes, not just pain, is so important. Now, here's something many people don't realize. Weakness isn't always dramatic. It doesn't always mean collapsing to the floor or being unable to move. Sometimes it's simply struggling to button a shirt, dropping your car keys, missing your mouth while taking a sip of water, or finding it surprisingly difficult to write your name. These may seem like small inconveniences, but when they appear suddenly and without explanation, your brain may be telling you it needs immediate medical attention. And if weakness isn't the symptom, the next warning sign can be even easier to overlook because it often feels like simple exhaustion, yet it may signal that the brain is struggling in a very different way. Another warning sign that surprises many people has nothing to do with weakness at all. Instead, it affects something we use every single day without even thinking about it: our ability to speak and understand. Have you ever walked into a room and forgotten why you were there? Almost everyone has. That's a normal part of life and becomes more common as we get older. But imagine this instead. You're having breakfast with your spouse, and suddenly you know exactly what you want to say, but the words just won't come out. Or someone asks you a simple question, and for a few moments their words sound confusing, almost like they're speaking a different language. That isn't ordinary forgetfulness. It can be one of the brain's most important warning signals. Our brains rely on a constant supply of oxygen-rich blood to control language. If blood flow is interrupted, even briefly, the areas responsible for speaking or understanding can stop working properly. The result may be sudden slurred speech, difficulty finding words, or saying something that simply doesn't make sense. One woman described trying to ask her husband for a glass of water. She knew exactly what she wanted, but instead of saying water, completely unrelated words came out. Within minutes, her speech returned to normal, so she assumed she was just overtired. The following morning, she suffered a major stroke. Stories like this remind us why it's so important not to dismiss sudden changes in communication. Sometimes, family members notice it first. A son may hear his father repeating the same sentence. A wife may notice her husband's words suddenly become slurred. A friend may ask, "Are you feeling okay? You're not making much sense." If someone says that to you, don't laugh it off. Take it seriously. The next small change can be even more subtle because it involves your vision. Many people expect a stroke to cause complete blindness, but that's not usually how it begins. Instead, vision changes may appear suddenly in one eye or affect part of your field of vision. You may notice blurry vision while reading the morning newspaper. You might feel as if a curtain briefly covered one side of your sight. Some people describe seeing double or feeling as though they can't focus on objects that were perfectly clear just moments earlier. Because these symptoms often disappear quickly, they're easy to blame on dry eyes, needing new glasses, or simply being tired. But sudden vision changes are never something to ignore. Your eyes may be healthy, yet your brain may not be receiving enough blood to properly process what you're seeing. Here's another situation many people don't connect to stroke risk. You're taking your usual morning walk around the neighborhood. You've walked this route hundreds of times before. Suddenly, you feel unusually unsteady. It's not the spinning sensation of standing up too quickly, and it doesn't feel like you've tripped over something. Instead, it's as if your balance has disappeared for no obvious reason. You find yourself reaching for a fence, a shopping cart, or your spouse's arm to steady yourself. Then, just as quickly as it started, it passes. Many people blame this on aging. Others think it's an inner ear problem. Sometimes that's true. But sudden dizziness, unexplained loss of balance, or difficulty walking, especially when it comes on out of nowhere and is accompanied by another symptom like vision changes or slurred speech, can also be a warning sign that requires immediate medical evaluation. One helpful way to remember this is to ask yourself a simple question. Is this normal for me? Not for someone your age, not for your neighbor, for you. Your body has its own normal. When something changes suddenly without a clear explanation, your brain deserves the benefit of the doubt. The encouraging news is that recognizing these early warning signs gives you the opportunity to act quickly. And in stroke care, acting quickly can make a remarkable difference. The next signs are among the most overlooked of all because many people mistake them for everyday headaches, stress, or simple fatigue, when they may be signaling something much more serious. There are two more warning signs that are often dismissed because they seem so ordinary. The first is a sudden, severe headache. Now, not every headache is a stroke, and most headaches are caused by far less serious conditions. But if you've never been someone who gets headaches and all of a sudden you experience an intense headache unlike anything you've felt before, especially if it's accompanied by weakness, confusion, vision changes, or trouble speaking, that's a reason to seek emergency medical care right away. Many stroke survivors later describe it as the worst headache of my life, or a headache that felt completely different. The key isn't just how painful it is, it's how suddenly it appears and how different it feels from your usual experience. Here's another scenario. You're watching television in the evening. Everything has been normal all day. Then, out of nowhere, you develop a pounding headache, and bright lights suddenly seem unbearable. You feel unusually nauseated, and something just doesn't feel right. Your first instinct might be to lie down and hope it passes. But when a headache is sudden, severe, and accompanied by other neurological symptoms, hoping isn't the safest strategy. Calling emergency services immediately could save brain tissue, and possibly your life. The seventh warning sign isn't always obvious to the person experiencing it. It's sudden confusion or unusual behavior. This can be especially difficult for families because it may look like simple forgetfulness or fatigue. Imagine your normally organized wife suddenly forgetting how to operate the microwave she's used every day for years, or your husband, who never gets lost, suddenly becoming confused in a familiar grocery store. Perhaps a parent begins asking the same question repeatedly within a few minutes, or seems unable to follow a simple conversation. These changes can happen because different parts of the brain control memory, attention, judgment, and decision-making. When blood flow is interrupted, those abilities can change almost instantly. Again, the important word is sudden. Gradual memory decline over months or years is a different situation from someone who is thinking clearly one moment and becomes noticeably confused the next. Family members often notice this before the individual does. They may say, "You're not acting like yourself. That doesn't sound like you. Something feels different." If someone who knows you well says that during a sudden episode, don't dismiss it. Trust their observation. Sometimes they're seeing what you cannot. By now, you may have noticed a common theme. Every one of these warning signs shares something important. They appear unexpectedly, not gradually, not over several months, but suddenly. Whether it's weakness, slurred speech, blurred vision, loss of balance, severe headache, or sudden confusion, these symptoms deserve immediate attention. Doctors often use a simple tool called B fast to help people recognize possible stroke symptoms. B, balance. Sudden loss of balance or coordination. E, eyes. Sudden trouble seeing in one or both eyes. F, face. Ask the person to smile. Does one side droop? A, arms. Can they raise both arms equally or does one drift downward? S, speech. Is their speech slurred or difficult to understand? T, time. If any of these signs appear, it's time to call emergency services immediately. Notice that the final letter isn't another symptom. It's time. Because every minute matters. One of the biggest mistakes people make is waiting to see if it gets better. They don't want to bother anyone. They don't want to overreact. They don't want to make an embarrassing trip to the emergency room if it turns out to be nothing. But when it comes to a possible stroke, it's always better to be evaluated and discover it wasn't a stroke than to stay home while precious brain cells are being damaged. Remember, even if symptoms disappear after a few minutes, they may still represent a transient ischemic attack, TIA, a serious warning that should be evaluated immediately. Listening to your body isn't about living in fear. It's about recognizing when something is truly out of the ordinary and responding without delay. That simple decision could change the rest of your life, or someone else's. If there's one message I hope you take away from today's conversation, it's this. Your brain often whispers before it screams. The warning signs we've talked about today may seem small on their own. A little weakness in one arm, a few slurred words, blurry vision that comes and goes, a sudden loss of balance, an unusually severe headache, a moment of confusion that doesn't feel like you. Individually, each of these symptoms can have many possible causes. But when they appear suddenly, especially if they're new or occur together, they should never be ignored. You know your body better than anyone else. You know what's normal for you. And when something feels dramatically different, trust that instinct. I've met many people who later said, "I knew something wasn't right, but I didn't want to make a fuss." Others didn't want to wake their spouse in the middle of the night. Some worried about the cost of an ambulance or thought they'd be embarrassed if it turned out to be nothing. The truth is, emergency doctors would much rather evaluate someone who isn't having a stroke than have someone stay home while a stroke is progressing. When it comes to your brain, it's always better to be safe than sorry. There are also simple lifestyle habits that can help lower your overall risk of stroke over time. Keeping your blood pressure under control is one of the most important steps you can take. High blood pressure is one of the biggest risk factors for stroke, and because it often has no symptoms, regular checkups are essential. If you have diabetes, work with your healthcare provider to keep your blood sugar in a healthy range. Uncontrolled diabetes can damage blood vessels throughout the body, including those that supply the brain. If you smoke, know that quitting is one of the best gifts you can give your brain and your heart. It's never too late to benefit from stopping. Stay physically active in ways that are appropriate for your fitness level. Even a brisk walk around your neighborhood, most days of the week, can support healthy circulation, improve heart health, and help manage blood pressure. Choose a balanced eating pattern that includes plenty of vegetables, fruits, whole grains, lean proteins, and healthy fats while limiting excess salt, added sugars, and heavily processed foods. And don't overlook the basics. Aim for good quality sleep. Stay well hydrated. Take medications exactly as prescribed. Keep up with routine medical appointments. These everyday habits may not seem exciting, but together they can make a meaningful difference in supporting long-term brain health. Finally, I'd like you to remember one simple phrase: be fast, balance, eyes, face, arms, speech, time. If you ever notice these symptoms in yourself or someone else, don't wait to see if they'll disappear. Call emergency services immediately. Fast treatment can significantly improve the chances of recovery and reduce the risk of lasting disability. I hope you never need to use the information you've learned today. But if that day ever comes, for you, your spouse, a friend, or a loved one, I hope you'll recognize the signs, act quickly, and encourage others to do the same. Thank you for spending this time with me today. If you found this video helpful, consider sharing it with your family and friends. You never know whose life this information might help protect. I'm Dr. Richard, and until next time, take good care of yourself, stay informed, and remember that paying attention to small changes today may help protect your health tomorrow.